Today, Senate Democrats released an ad about the Republican Medicaid cuts designed to impact the states where Democrats believe they can win Senate seats. That bill, of course, was signed into law by Donald Trump.
The Senate narrowly passed the president's sweeping budget bill,
proposing huge cuts to Medicaid.
More than 11 million Americans are expected to lose their health care.
200,000 Georgians could lose Medicaid coverage or private insurance.
In Michigan, rural hospitals could see their doors close.
1 in 4 North Carolinians could have their health care at risk.
We're talking about the most vulnerable patients in the state of Maine.
This bill is horrible for Alaskans.
The bill doesn't just cut health care access, it cuts lifelines.
The Georgia Recorder reports this about potential hospital closings in Georgia. Quote, according to a report from researchers at the University of North Carolina, Chapel Hill, 4 hospitals in rural Georgia are at risk of reducing services or closing altogether under the mega bill. 3 of those hospitals are in districts represented by Republican congressmen who voted in favor of the bill. Joining our discussion now is Democratic Senator Jon Ossoff of Georgia, a member of the Senate Intelligence Committee, the Senate Appropriations Committee, and the Senate Rules Committee. He is running for re-election next year in Georgia. Senator Ossoff, thank you very much for joining us tonight. I note that in that Democratic Senate ad, it is aimed at Georgia and other states with important Senate races next year for the Democrats. This apparently is going to be the key to the re-election strategy or the election strategy of some new Democrats. How important will this be to your campaign?
Lawrence, thank you for having me. And this is a political disaster for Republicans in Georgia because it is a real-life disaster for my constituents. And, you know, you reveal your true colors and your true preferences when the rubber meets the road and you pass a multi-trillion-dollar spending bill. And they chose to loot the public treasury, indebt future generations to the tune of trillions of dollars, make healthcare more expensive for the vast majority of Americans, push hospitals and nursing homes toward bankruptcy, to pay for tax cuts that mostly benefit the wealthy and well-connected. And there is no constituency for this. There is no voting bloc in Georgia that's crying out for more expensive health care so that the rich can pay lower taxes. And it just demonstrates that this fake populist veneer of Trumpism, this pretend concern for working class men and women, is a lie. Because when the time came to make policy, trillions of dollars of policy, they have sold out regular people in Georgia and across the country to benefit the wealthy and well-connected, and it's corruption in action right there in plain sight.
So the Republicans wrote this bill so that the Medicaid cuts do not take effect next year before your Senate election. And so you will be running, no doubt, against a Republican who will be able to say, none of these cuts have happened yet, and so all of this scare talk has been unnecessary.
Well, first of all, you mentioned a number of Georgia hospitals. There are as many as 20 Georgia hospitals that are at risk of closure across the state of Georgia. We've already lost 9 or 10 in the last 10 years. And their finances, their impact, their prospects, their potential to attract investment and to generate financing is immediately impacted. So the risk to hospitals and nursing homes is here now. Not to mention, the failure to renew Affordable Care Act benefits means that hundreds of thousands of my constituents are likely to see huge increases in their health insurance premiums next year, not in 2027, not in 2028, but next year. And the public sees this for what it is. It is a giveaway. It is a handout to wealthy political donors paid for with trillions of dollars of debt that's undermining international confidence in the creditworthiness of the United States and damaging the value of the dollar, and paid for by ripping health care away from working class and middle class families in Georgia and pushing the whole health care system closer and closer to financial insolvency.
We just saw affordability of just living affordability in New York City become the issue in the mayor's race in New York. How does that work in Georgia? And is there a similar theme to be struck in Georgia?
Absolutely. And that is why, look, the most important thing about this bill is that it is a disaster for human beings, for the health and welfare of human beings. But it is also political malpractice for the Republican Party to gain power and use that power to drive up health care costs for the vast majority of Americans at a time when the cost of living is the #1 public concern, and especially when it comes to health insurance premiums and the cost of health care.
Georgia Senator Jon Ossoff, thank you very much for joining us tonight.
Thank you, Lawrence.
And coming up, today, Donald Trump said something about Vladimir Putin that he has never said before. That's next.